Hi, my name is Cindy Chaplin, and I've been a nurse for 43 years. So here at MiraVista Behavioral Health Center, we are a Narcan distribution center. So you can walk in the front door and ask the receptionist that you would like a Narcan dose. You'll be given this box, which has 2 doses in it. Don't keep it in your car. It can't be exposed to high heats, but keep it like in a backpack or something that you would take in and out of your car. This is the magnet you would get that you can put on your fridge, but it tells you step by step what to do when you find someone unresponsive. All that we ask is your name and your address. You can come back as many times as you need to get doses or send in your family or friends. So Narcan is an opiate antagonist. What it does is it goes into the nose when we give it and travels to the brain. The brain has natural opiate receptors. So anytime you take an opiate, the opiate attaches itself to the receptor in the brain. Narcan knocks the opiate off the receptor and replaces it with itself. So that the side effects of the opiate, such as sedation and slowed breathing, can no longer happen because the opiate is not attached to a receptor. And when the Narcan kicks in, the person then wakes up and starts breathing. So in order for us to be effective in using Narcan, we need to recognize when someone has an opiate overdose. Opiates affect the breathing and also the pupils in the eye. So when I shake and shout and the person is unresponsive, I call 911. I look to see if they're breathing. If they're not breathing or breathing very shallow or very little, I want to get my Narcan ready. The third thing I look for is the pupils. I open a person's eye to see if the pupils are very, very tiny. They're called pinpoint pupils. That's a telltale sign of opiate overdose. Then I know when I give the Narcan, it should help the person recover. So Narcan is a unique drug in that even if I give it to a patient who has not overdosed on opiates but overdosed on something else, it is not going to harm the patient. Its sole purpose is to knock the opiate receptors off of the brain receptors and fill it with itself. So if I give it to a patient and they don't wake up or they find out that the person hasn't taken opiates, it will not harm them. It's only got one job. So I'm going to demonstrate how you would administer Narcan. First, you want to shake and shout. If the person is unresponsive, you call 911 right away. If you have a smartphone, leave it on speakerphone because they can be very helpful in telling you what to do. Secondly, if you think it's an opiate overdose because you've checked for signs, the pupils are small, the breathing is not regular or absent, you want to give Narcan. Narcan looks like this. It has a rounded end that goes in the nose, and the bottom has a plunger to administer the medication. It's a fine mist, and it goes up the nose. I put this in, lay the person on their back. I put this in their nose, and as soon as it's in as far as it can go, I press the plunger that gives the dose of Narcan. I remove it, and it's now complete. You want to wait 2 to 3 minutes, but you want to also monitor the patient. So in that 2 to 3 minutes, are they breathing? If they're breathing, turn them on their side. If they're not, you may have to breathe for them. 1 breath every 5 to 6 seconds. If they don't have a heart rate, you might have to do chest compressions. If you do not know how to do either one of those, that's why we called 911 to get help there as fast as possible. Leave them on their back if they're not breathing with their head tilted back. That helps when they do start breathing to be able to breathe easier. If 3 minutes have gone by and you see no results, you can give your second dose. There is no limit on how many doses you give. A lot of the long-acting opiates, such as fentanyl or carfentanil, take a lot of doses of Narcan in order for them to wake up. And sometimes it can be as high as 8 doses. We only recommend that you give 2 until further help arrives, just because you're not medically trained. Once help arrives, they will take over. They will probably give Narcan IV. They will do an assessment, but this is a life-saving drug. It wakes people up, helps them breathe, and so that maybe they can go in for further treatment for their addiction.